Hi, I'm Erin Garvin with Empower Pilates and Yoga, and today I'm going to show you how to relieve lower back pain using a tennis ball. So there are two main muscles that we're going to relieve trigger points from, the erector spinae and the quadratus lumborum, or QL. So first, take your hands at your lower back on either side of your spine. And the big ropey muscle that runs vertically along the spine is the erector spinae. Dig your thumbs into that and just notice how it feels. And now go a little bit outside of that muscle and you should be able to access the QL, or quadratus lumborum. That's the real nemesis in most people's low back pain because it attaches to a bone that is not fixed, the lowest ribs. The lowest ribs are not fixed. So you're going to find the space between the lowest rib and the highest part of your pelvis, or ilium, on the right side. We'll just start on that side, but you can start on either one. And place that tennis ball on that outside border. Now we're gonna lie down and put weight on that ball. So lie down, and there's the spot. And you're gonna put your body weight on that tennis ball. If you're in acute low back pain, that may be enough. If you would like to add on, pull your thigh into your belly and let your thigh and your body weight sink into the tennis ball. You should feel some type of pain here, or a spot that feels tight. If you don't, take your hand, move the tennis ball either a little up or down or outside, and find a spot that needs attention. So if you can tolerate more, then gently move your thigh in circles. Keep relaxing into the tennis ball because the body is really good at getting away from pain, and so your body's going to probably naturally try to arch away, but you want to keep sinking and relaxing into that tennis ball. Usually with the thigh circles, you're going to find this moves the fibers of the lower back, and you get some spots that are more painful than others. So when I move my thigh to the outside, and that's very common, you're going to find more therapeutic implications here. You're going to feel that it's more intense. So this is a spot where I'm going to hold for about 30 seconds or 5 cycles of inhale and exhale. Relaxing the muscles underneath the tennis ball and relaxing other muscles that might be accidentally getting stressed by the pain. So the shoulder blades are relaxed down the back, the face is relaxed, the glutes are relaxed, and then let's take that thigh in a few more circles. All right, and there's another spot just by pulling the leg in. So I'm gonna sink into the tennis ball and relax the low back, relax my shoulder blades, and relax my face. And now let's find another trigger point. Go either up or down along that outside edge of the ropey muscle, and you don't want to be on the rib and you don't want to be on the pelvis, but you want to just be on the outside of that ropey muscle. So I moved the tennis ball down a little bit, and now let's move that thigh and see right there when the thigh is out, you can usually feel more intense pain. And so let's just let that be a spot where we sink. Whenever you have an exquisite point of pain, that's the classic definition of a trigger point. Another way people describe it is that if they were standing up and they were to feel that pain, their knees feel like they would buckle, or it almost takes your breath away. We want to make sure that we are continuing to breathe, that it's not so painful that we have to hold our breath to manage the myofascial release, but that we can keep breathing calmly. And now let's do another trigger point. We're going to let the tennis ball go underneath the ropey muscle this time, just to see if there's anything on that erector spinae. You might have spots on the QL and on the erector spinae. So you're going to begin, as you do these tennis ball releases, to find where do you need it. So my erector spinae definitely is not as sensitive as the QL, but you want to discover for yourself, where do you have sensitivity. And I'm going to move that leg around, and there's a spot where the knee feels like it's at about 2 o'clock if my thigh were spinning around a clock, and that's a good spot for me. So I'm going to relax the shoulder blades down the back, relax my glutes, relax my face, and then Let's take that tennis ball out. We've done 3 trigger points, 2 on the QL, 1 on the erector spinae, but it doesn't matter, wherever you need it is where you did it. Now just take a moment to do a bilateral comparison. Compare the right to the left. So the side that you released, how does it feel compared to the side you did not relieve? Breathe into that lower back, the lower diaphragm. Fibers are attached to the lower back, so you're sending some oxygenated movement down there, oxygenated blood. And see if you have some relief from where we did the tennis ball, the myofascial release with the tennis ball, and then you know that you have this tool in your back pocket anytime you need it, anytime that you're in low back pain. So of course you're going to want to do the other side, and you can do this as you need whenever you get low back pain, or you can keep that low back pain away and do it several times a week, especially when you're doing extra chores that might involve the low back, or an extra hobby that involves the low back, or you're traveling for long periods of time. Thank you so much for joining me, and please let me know if this video helped you, and also let me know what other fitness tips or pain release you would like to learn more about. Thank you and have a good day.